Welcome to today's lecture on the topic of medical nanotechnology and its application in skin drug delivery. In this comprehensive script, we will delve into various aspects of this field, ranging from the structure of the skin to the future prospects of nanoscale drug delivery. So without further ado, let's begin our journey into the fascinating world of medical nanotechnology. To understand how nanoscale drug delivery systems work, it is crucial to comprehend the structure and barrier functions of the skin. The human skin is composed of three primary layers: the epidermis, the dermis, and the hypodermis. The outermost layer, the epidermis, acts as the main barrier between our bodies and the external environment. Its unique structure, consisting of specialized cells called keratinocytes and lipid-rich intercellular spaces, restricts the permeation of foreign substances. Additionally, the composition of the stratum corneum further contributes to the skin's barrier functions. One of the key applications of medical nanotechnology in skin drug delivery is the use of nanoparticles as drug carriers. Nanoparticles possess unique properties due to their small size and large surface area. These characteristics allow for enhanced drug loading, improved stability, and controlled release profiles. The use of nanoparticles in topical drug delivery enables targeted delivery of therapeutics to specific skin layers or cells, ensuring optimal efficacy and minimizing side effects. Examples of nanoparticle systems commonly employed in skin drug delivery include liposomes, polymeric nanoparticles, and solid lipid nanoparticles. Transdermal drug delivery, which involves the passage of drugs through the skin and into systemic circulation, presents a convenient and non-invasive route of administration. Nanosystems have shown great potential in enhancing transdermal drug delivery by overcoming the skin's barrier properties. The use of nanocarriers, such as lipid-based vesicles and polymeric nanoparticles, allows for the efficient encapsulation and penetration of drugs through the skin. Furthermore, strategies such as the use of physical enhancers, such as microneedles and ultrasound, can further enhance transdermal drug delivery by creating pathways for drug permeation. In some cases, it is desirable to target specific areas of the skin for drug delivery, such as hair follicles, sweat glands, or deeper skin layers. Nanotechnology offers various strategies to achieve targeted drug delivery. Active targeting involves the modification of nanocarriers with ligands that can recognize and bind to specific receptors on target cells. Passive targeting relies on the enhanced permeation and retention effect, which takes advantage of the leaky vasculature in pathological conditions. By employing these strategies, nanoscale drug delivery systems can selectively accumulate in the desired areas, improving therapeutic outcomes. To enhance the penetration of drugs through the skin, chemical modifications of drug molecules or carriers can be employed. For example, prodrugs can be used, wherein a physiologically inactive compound is transformed into its active form upon topical application or in response to specific stimuli. Another approach is the use of permeation enhancers, which can disrupt the lipid organization of the stratum corneum or alter its permeability. However, it is essential to carefully evaluate the safety and potential side effects of these modifications to ensure patient safety. The optimization of nanocarriers plays a critical role in maximizing their potential for dermal drug delivery. This involves considerations such as selecting appropriate materials, optimizing particle size and shape, and controlling drug encapsulation and release kinetics. Factors like the physicochemical properties of the drug, the stability of the carrier, and the desired release profile need to be taken into account during the optimization process. Advances in nanotechnology have allowed for the development of sophisticated characterization techniques to assess the performance and efficacy of nanocarriers. Monitoring drug release from nanocarriers in real time can provide insights into their behavior and efficacy. Nanosensors are emerging as a powerful tool in this context, allowing sensitive and selective detection of drugs in the skin. These nanosensors can be designed to respond to specific molecules or exhibit changes in their optical or electrical properties upon drug release. Monitoring drug release kinetics can aid in tailoring therapeutic dosing regimens and optimizing treatment outcomes. However, extensive research is still required to develop nanosensors with high sensitivity and specificity. As with any medical intervention, safety and toxicity considerations are of utmost importance in nanoscale skin drug delivery. The potential toxic effects of nanoparticles on the skin and other organs should be thoroughly investigated. Studies have shown that factors such as particle size, surface charge, and composition can influence nanoparticle toxicity. Biocompatibility assessments, including in vitro and in vivo studies, help evaluate the safety profile of nanoscale drug delivery systems. Successful translation of these technologies into clinical applications necessitates a comprehensive understanding of their potential risks. The successful penetration of nanoparticles through the skin involves various mechanisms. These mechanisms include absorption through the intercellular lipid lamella, diffusion through the skin appendages like hair follicles and sweat glands, and cellular uptake. The physicochemical properties of nanoparticles, such as their size, surface charge, and hydrophobicity, play a crucial role in determining their penetration route. Understanding the skin penetration mechanisms of nanoparticles enables researchers to design nanoscale drug delivery systems that optimize their penetration efficiency. The combination of nanotechnology with other delivery methods, such as microneedles and ultrasound, shows great promise in enhancing transdermal drug delivery. Microneedles create micropores in the stratum corneum, allowing for improved drug permeation. Nanoparticles can be loaded into these microneedles to facilitate the sustained release of drugs. Ultrasound-assisted drug delivery utilizes the mechanical and thermal effects of ultrasound waves to enhance skin permeability. Nanoscale drug delivery systems can be engineered to respond to ultrasound, allowing for controlled release at specific skin depths. Accurate characterization of nanoscale drug delivery systems is essential for understanding their behavior and optimizing their performance. Various techniques are employed to analyze particle size and distribution, surface charge, morphology, drug loading, and release kinetics. Commonly used techniques include dynamic light scattering, transmission electron microscopy, atomic force microscopy, and spectroscopic methods. These characterization methods provide valuable insights into the physicochemical properties of nanoscale drug delivery systems, assisting in their development and formulation. The field of nanoscale drug delivery to the skin is continuously evolving, and future advancements hold immense potential. Researchers are exploring innovative approaches, such as the use of stimuli-responsive nanocarriers that release drugs in response to specific cues, such as pH or temperature changes. Additionally, the integration of nanotechnology with personalized medicine and the development of smart wearable devices for targeted and controlled drug delivery are areas of active research. The convergence of nanotechnology, materials science, and biotechnology is paving the way for groundbreaking advancements in skin drug delivery. In conclusion, medical nanotechnology offers exciting opportunities for enhancing drug delivery to the skin. The unique properties of nanoscale drug delivery systems enable improved penetration, targeted delivery, and controlled release of therapeutics. However, careful considerations must be given to safety and toxicity aspects, and continuous research is necessary to unlock the full potential of this field. With advancements in nanoscale drug delivery systems and their characterization techniques, we are poised to witness significant breakthroughs in personalized and effective skin drug delivery in the near future.